Welcome back to Pharmacy Tech Mastery. This is your ultimate cheat sheet for pharmacy math. The best tips, tricks, and memory aids to make calculations faster, easier, and less stressful. These strategies aren't shortcuts that skip safety. They're proven ways to help you think clearly, work accurately, and reduce the chance of error. Tip number 1. Use the metric ladder for quick conversions. 1 kilogram equals 1,000 grams. 1 gram equals 1,000 milligrams. 1 milligram equals 1,000 micrograms. Move the decimal 3 places for each step. Tip number 2. Remember your core formulas. Dose equals weight, times milligrams per kilogram. For flow rate, milliliters per hour equals volume divided by time, hours. IV flow rate, GTT per minute, equals volume times drop factor, divided by time, minutes. Tip number 3. For alligation, always subtract diagonally. High minus desired gives you the parts of the lower strength. Desired minus low gives you the parts of the higher strength. Tip number 4. For dilutions, memorize V1 times C1 equals V2 times C2. Keep units consistent. And remember, this only changes concentration, not the total drug amount. Tip number 5. Convert between percent and milligrams per milliliter fast. 1% equals 10 milligrams per milliliter. So 2.5%? That's 25 milligrams per milliliter. Always double-check your math. Write out units at every step. When in doubt, stop and ask the pharmacist. Let's rapid fire. 500 milligrams in 250 milliliters over 2 hours. Milliliters per hour. 125 milliliters per hour. Convert 0.25% to milligrams per milliliter. 2.5 milligrams per milliliter. 70 kilograms times 5 milligrams per kilogram. 350 milligram dose. You've just mastered pharmacy math tips that'll serve you for your whole career. Hit subscribe and click the bell for more pharmacy tech training and keep practicing, because confidence comes from repetition. See you in the next course.